Abidemi Mary. Good evening, matron.
Good evening.
Matron Olatunji, forgive me, is a qualified and registered nurse. She started her nursing career at the School of Nursing, University College Hospital, UCH, Ibadan, in 1989. She proceeded to School of Midwifery, Yemetu Adioye, Ibadan. Matron Olatunji had her public health nursing training at the School of Public Health Nursing, Ikoyi, Lagos, where she was awarded higher national diploma in public health and reproductive health nursing. She has attended several trainings, amongst which are leadership in health, nursing leadership, excellent care, neonatal resuscitation, maternal and child safety, etc. Matron Olatunji is a member of National Association of Nigerian Nurses and Midwives, NANNM. Matron Olatunji is in charge of immunization section at Lagoon Hospitals. Welcome again, Matron Olatunji.
Thank you for having me.
Interesting that we should be talking immunization on today's show, and I think before now, when one is thinking immunization, you're thinking predominantly about babies and children, a sort of thing. But now we're finding that, hey, even as an adult, it's important to get immunized against a wide range of various ailments that can afflict one. Yes?
Yes, sir.
Right, so let's still start at the beginning. What is immunization?
Thank you very much. Immunization is a process of protecting an individual against a specific diseases or infections through the activities of inoculation.
Yes.
Yeah.
I see. Like the COVID immunization, isn't it?
Example is the COVID immunization.
Yes.
There are several other immunizations that really need to be protected against, like poliomyelitis,
Yes.
tuberculosis,
Yes.
diphtheria, pertussis, influenza, meningitis, measles, chickenpox, and so many others.
Yes. So is immunization different from vaccination?
No. Immunization is otherwise known as vaccination.
So they're one and the same thing.
They are one and the same thing.
All right. So why is it important? The body, because to the glory of God, really, we've been created such that our bodies kick into gear once they find some sort of foreign body that might be harmful to us. Our bodies begin a process to fight itself. Am I correct?
You are correct.
So why is immunization important?
Immunization is very, very important because there are so many aspects to immunization. Yes, you are very right. You are very correct that sometimes, somehow, our body tends to develop immunities and antibodies against some diseases.
Yes.
But you also believe with me that when these new babies are delivered, their immunity is very, very low. For example, a newborn baby that requires hepatitis B, HBV0 at birth within 24 hours, just to make sure that the baby is protected against diseases of the liver and what have you.
Yes.
Also, the BCG immunization, the baby doesn't have BCG protection at birth, but by giving BCG immunization, the baby is being protected against tuberculosis, which tends to be a killer disease of childhood in Nigeria, and so many other diseases as well.
All right, matron. Let's go to the stages of immunization.
Yeah.
What are they? What are the
Thank
stages?
Thank you for the benefit of this presentation. In Lagoon Hospital, we have different stages of immunization. Then I would like to discuss them under the following headings.
Okay.
The first thing we do is the assessment of the baby. Assessment of the baby as the mother brings them to the hospital. Within a twinkle of an eye, we look at the baby from head to toe. Is the baby healthy enough for any form of immunization? Then we take history from the mother. Very brief history. How old is the baby? When was the date of birth? For example, a 6-week-old baby has some specific immunization to be taken, which is not ideal for 2-day-old baby. Like a 6-week-old baby supposed to take Rota 1, Pneumococcal 1, pentavalent one and OPV one.
Yes.
So in history taking, we are able to assess this baby with the date of birth. We cross-check that, I'm having a right baby in front of me for the right immunization. Another one we need to do is to take vitals of this baby, because in immunization clinic in Lagoon Hospital, some mothers bring their baby for immunization, whereas the baby is not healthy enough for immunization.
Yes.
Maybe the baby is really, really sick, suffering from flu or cold or fever that has to be treated by pediatrician rather than taking immunization. So we do prompt referral of such a baby. So after checking the vitals, then we now go to the administration of the immunization itself. So we make sure we give the right dose to the right age of the baby. Then we also ensure for the right route of administration, because some vaccines could be oral, it could be intramuscular, it could be under the skin, subcutaneous, and so on and so forth. Then the last stage I would like to mention is to give follow-up on appointment. For every child that comes to the clinic, there is a way we follow up to ensure that the baby is duly immunized before the age of 5 years. So those are the different stages I would like to discuss.
Those are the different. Are there any of the stages that are more important than others?
All the stages are very, very important, but for my mother, nursing mothers out there, for them to be very, very observant, what I would say the most important stage is the act of administration of the vaccine. A nurse have to be very, very concentrating when she's really, really giving the immunization.
Yes.
Concentrate, 100% concentration with the act of giving the immunization, making sure she's giving the right dose to the right baby at the right route. She shouldn't give intramuscular injection where she's supposed to give intradermal. And oral immunization should never be given intramuscularly.
Let's use a few technical terms there. Intramuscular is like you give a shot into the muscle in the arm, for instance, or the bottom.
No, we don't give immunization on the bottom.
At all? Is there a reason for that?
Yeah, immunization on the bottom is totally eradicated. Immunizations are given at the safest, like middle-lateral aspect of either left or right thigh, where we have enough muscles, which is really, really far away from sciatic nerves, so that the baby will not come down with paralysis. A lot of complications come with immunizations on the bottom, like injection abscess, or paralysis of one leg, that affected limb. But no immunization.
Is this in babies or in everyone?
Sir, I would say in everyone.
Yes.
In everyone.
All right. So what exactly is this? Is the immunization? There's all sorts of things flying around, and I understand that you're not a doctor. So if I throw something that's awkward, I will understand if you say that one should get that information from a doctor, and I'll seek to find out. But you have had people who say, getting a vaccine, they'll actually introduce whatever disease it is that you're getting immunized against. That's what gets introduced into the system, so that your body can then sort of get used to it or get used to fighting it. And so when you're exposed to the disease, your body is equipped to handle it. Is that true?
That is very true. In fact, that is the principle of immunization, and that is how immunization works. Immunization works by introducing an antigen into the body in form of inoculation, in form of injection. So this kind of antigen is being introduced into the body, and it will remain there for a while. So in subsequent later in future, when the body comes in contact with the same disease at which this inoculation was being introduced, the body will resist and get to know, there's something in this host, there's something in that individual that is already producing immunity. So the person will be able to fight back this particular disease that he or she have been immunized against. So you are very correct. I agree with you, sir. All
right. Will one's immune system be weaker by relying on immunization?
No, the immune system is not going to get weaker. Rather, it's going to get boosted when it comes in contact with that kind of disease subsequently in life.
Yes. Thank you very much. In case you've just tuned in, you're listening to Live More Life, brought to you by Lagoon Hospitals. And on today's show, we are discussing the importance of immunization. We have the pleasure of the company of Matron Olatunji Abidemi Mary, who has so far taken us through what immunization actually is, why immunization is important, and she's also pointed out that immunization is pretty much the same thing as vaccination, and has taken us through the various stages of immunization. If you have any questions at all about immunization, well, take advantage of Matron being in the studio and call in or send us those questions via WhatsApp. Our WhatsApp number is 0909-217-2973. The number again is 0909-217-2973. You can also call into the studio on 01515-0973 and 01515-1973. The phone numbers again are 01515-0973 and 01515-1973. Matron, are there any complications of not taking immunization? Hold that thought. Let's take our first phone call.
All right.
Hello.
Yes, good evening. It's Live More Life.
Yes, my name is Toby.
Good evening, Toby. What's your question for Matron?
Okay. My baby is due to collect the measles immunization, but I had a friend of mine who complained about the vaccination or immunization. Rather, he said most people take measles vaccination. They have this tendency of Down syndrome or sickness. I don't know how true that is, but she gave me instances that is true, happens to some people, and I went online and found some acts of truth of what she said. So I don't know, is this true, is it proven? I want Baker to shed more light on this.
Thank you very much for calling in. Please do keep listening. Matron will answer your question now.
Thank you.
So, Matron,
Huh?
true or false? You heard the question. Yes,
It's false.
it's false.
So I would like to clarify a misconception
Yes.
to reassure her to take her baby to the immunization clinic for that measles. Should I do that now?
Yes, please go ahead.
Hello, our mothers at home. I so much appreciate your questions thrown to me just now, but I want to reassure you that there is a misconception that maybe somebody that was not really very comfortable has given to you. Measles vaccines are given to children at 9 months, and measles vaccine is very, very safe. So it has been proven safe by WHO, passing through all the clinical trials and endorsed. So please, I will encourage you to kindly take your baby to the immunization clinic near to you or your HMO to make sure your baby is duly immunized. Measles vaccine is safe.
There, you've heard it from Matron. Measles vaccine is safe, and your baby will be more protected for taking it. And it's certainly better to be safe than to be sorry. So I was asking a question before the call came in, Matron. I was saying what the complications of not taking immunization are.
Okay. Sir, I so much appreciate the question, but I would like to give the response in this way. Okay, we can say complications or risk factors of babies that are not immunized. There are so many risk factors for babies that are not immunized.
Yes.
One of them is that the baby is really exposed to diseases and infections out there.
Yes.
All the bacteria responsible for diseases and infections, they are all still available within our community, even everywhere, almost everywhere, on the surfaces, on the doorknobs, everywhere at home and in workplace.
Yes.
So because and the complications can't just be packed together, but I'll just give about two major examples.
Do go ahead.
Complication or a risk factor for a child that is not duly immunized for BCG are as follows. BCG is a kind of vaccine that boosts the immunity against tuberculosis.
Yes.
And we all know that tuberculosis affects every part of the body. But let's take pulmonary tuberculosis as an example. That's the tuberculosis of the lungs. So a baby that is not immunized against TB will always come down with diseases of the lungs.
Yes.
The baby will not be able to pay attention in school, because when the baby comes in contact with the disease, it will surely break down because there is no immunity in that baby. The baby will tend to be having fever, headache, and hypoxia. Hypoxia is low oxygenation within the body system.
Yes.
And if such a baby manages to grow up and the TB disease is still in him or her, this baby will become a grown-up child and to be having something we have like hemoptysis, like coughing of blood, then pleural effusion, accumulation of fluid in the thorax, in the peritoneal cavity, that will require surgery intervention. Another one is complication or risk factor for a child that is not duly immunized for poliomyelitis. Poliomyelitis is a kind of disease that affects the central nervous system, the brain, and the spinal cord. So when this disease is deeply gets into the child that is not immunized at all against polio or not effectively immunized, the child can have nerves and neurons damages that can lead to paralysis later in future.
Wow.
So another one is like meningitis. Meningitis affects majorly the brain and the meninges, the coverings of the brain. So such a child may grow up to be having memory loss, deafness of the hair, and so many other complications that will not allow the child to be concentrating even in education.
Yes. Well, certainly does sound like the best advice that can be given to anyone is to make sure that you do get immunized. Yes, against a lot of these ailments. Now, I did say at the beginning of the show that a lot of times when we're thinking immunization, one is thinking babies, and we have been specifying that. But as an adult, are there, with the exception of the obvious one, COVID, are there other immunizations as an adult that one should be looking to take?
Yes,
just hold that thought, doctor. Let's take another. Hold that thought, matron.
Yes, sir.
Let's try and squeeze in another call.
Another question.
Good evening. Live more life.
Good evening, Chito.
Yes. Good evening. Who's calling and where are you calling from?
Well, my name is Pastor Ibira Richard.
Good evening, Pastor. Can you please turn your radio down?
I'm going all the way.
Thank you.
All right. Now my question.
Yes.
I just told you I'm a pastor.
Yes.
Sometime on Sunday, you see health workers. They are going around. They say they want to immunize children. Number one dilemma we have is that if a child who is being immunized is immunized again, any risk?
I see. It's an interesting question. Okay, thank you very much for calling in, Pastor. Matron will address that question now.
All right.
Thanks for calling in. Matron, a person, you do have health workers going around, even here in Lagos. So there's a chance, it sounds like what Pastor is saying, there's a chance that a child who's already been immunized might get immunized again. Is there any risk there?
Yeah, thank you very much, sir. This particular one the pastor is referring to, the activities that is being sponsored by WHO in collaboration with Ministry of Health during National Immunization Days. And these so-called vaccines that you see health workers going from house to house, place to house, from one community to another. They go to churches, they go to mosques, they go to everywhere, looking for children of certain age range to be re-immunized. So this...
to be re-immunized.
Is re-immunized.
I see.
These particular ones that they are going from house to house, they can be... is like a booster dose. And majorly most of these vaccines are oral polio, the one we drop into the mouth to just make sure that we are trying to eradicate poliomyelitis totally from Nigeria or from the surface of the earth.
I see.
So I would say to our pastor and to so many parents out there, these vaccines are really, really safe. They can be re-immunized. They are booster.
Lovely.
And the federal government of health pays a lot of money to ensure this program is being successfully carried out. So a lot of mothers also give me a call during these programs, and I do encourage them to go ahead and let their children be re-immunized. So they will show them the immunization card, mark where it's supposed to be, give a mark on the finger to make sure that during that particular program, that child is immunized only once around that period. So it is safe. they are safe.
Thank you very much. Thanks a lot. So let's go back to the question I asked before the call came in, where I was saying that a lot of times we concentrate on children, babies, infants, and so on. So my question is: are there other things as adults with? And I said let's set the COVID vaccination aside. Are there other things that, as an adult, you should say to yourself? Right. Well, I don't know if I ever had this. I better go searching and get immunized against.
Yeah, thank you very much. Yes, not only babies are immunized. A lot of adults are also due for immunization, according to what I would like just to throw little light on. For example, all pregnant women are supposed to be on tetanus toxoid immunization. Tetanus toxoid is a kind of vaccine that boosts the woman's immunity against tetanus toxoid disease that tends to cause seizures and spasm. Yes, that the baby can get when these babies are delivered and the mother is not. It's a kind of vaccine that babies get through their mom in utero, that is inside the pregnancy before the baby is delivered. So tetanus toxoid is one of them, and we give the first dose at least 20 weeks in pregnancy. We give the second dose 4 weeks after the first dose. We give the third dose 6 months after the second dose, the fourth dose a year after the third dose, and the fifth dose a year after the fourth dose. So that's 5 doses altogether. Gives life immunity to the mother, all women of childbearing age. Another one is we give the pneumococcal shot to adults that they are
pneumococcal
vaccine. Yes, to all adults that their immune is compromised. People like sicklers, even though they are adults, people with sickle cell disease, asthmatic patients, they are all susceptible to have pneumococcal shot to boost their immunity against diseases of the lungs, pneumonia, and things like that. Also, in Lagoon Hospital, what we do, according to what our family physician do, is all the elderly, 60 years and above, are also beneficiary of pneumococcal shots. Then some adults too, that they have comorbidities. Comorbidities are combination of so many diseases. Somebody that is hypertensive, is diabetic, is having urinary tract infection, and so many other diseases. So immunity is already low. That's why the patient is coming down with all these frequent comorbidity diseases. So we also benefit from all this, like pneumococcal shots. Then another one, please, is the Cervarix. Cervarix is a kind of vaccine that women take to prevent cervical cancer.
Yes, I thought so. As soon as I had Cervar, I'm like, okay. To prevent
cervical cancer in women. Because before this one can be done, the woman will definitely need to do a pap smear. So once the pap smear result is good, then she go ahead to do a Cervarix immunization, first, second, and third dose, respectively.
All right. Good evening. Live More Life. Good evening. Well, we can't hear you, so if you can hear me, you might want to disconnect and call back again. Good evening. All right, let's get rid of that. We can squeeze in perhaps one more phone call, so if you dial in now, let's try this. Good evening, Live More Life. Yes, good evening.
Yeah.
What's your name and where are you calling from?
My name is Bola Tito. I'm calling from Yaba.
All right. What's your question for Matron?
Yeah, quickly, I have 2 questions. Number one is about all these immunizers that move around. Yes. Because most times when you see them, they look so scary. They're not effective for health workers. So I don't know if government if these private organizations can do it such a way that people can come into their place and take those oral vaccines. That's why people at times do not like their children speaking. That is one. Then secondly, was talking about cervical something.
Yes.
And the immunization for those ones, like 3 shots. Must you be registered with the Lagoon because before you can access it, or you can different rate.
Yes.
Yeah.
All right. Thank you very much for calling in. Do keep listening. Matron will address your questions now.
Thank you, sir.
All right. I'm going to say that as for the first one, there's not really much that that Matron can say or do about that. That's a question for the health authorities, really. But let's speak to the second question.
The second
She wanted to know if one could just come in for the last vaccination you mentioned, to ensure that women don't develop perhaps cervical cancer, and so on. Whether that was something that you had to be registered at Lagoon hospitals to have, or whether one could just come in off the street to get the shot.
Thank you very much for the question. I will encourage the woman, even if she comes to Lagoon Hospital, just for the immunization, nothing else.
Yes.
There's a way the clinic managers will register her. That she might not really going to pay that kind of full registration payment.
Yes.
So there's a way they will check her in that she's for she's for cervical immunization, and she'll be duly attended to. So I'm really, really sure about Lagoon Hospital giving this kind of vaccine.
Yes.
But I think the vaccine is also available out there.
Yes.
But I'm so sorry, I won't be able to mention any hospital. But I'm really sure of Lagoon Hospital, and I can assure her when she comes, she will surely get it done.
Absolutely. Yeah. And the other vaccination, the one with the healthcare people authorities are going around with, it's also available at Lagoon hospitals if one wanted to come in just to get that particular shot, rather than wait for these healthcare workers to come to their place.
Yes, they are. They are routine vaccines.
Okay.
They are routine. They are always available at Lagoon Hospital across Lagos states. They are available.
Lovely jubbly. We've been talking to Matron Olatunji Abidemi Mary, and our topic today has been the importance of immunization. I want to say thank you very much, Matron. It's been really interesting.
Thank you for having me, sir.
Join us again, 7 p.m. next Tuesday for another edition of Live More Life, brought to you by Lagoon Hospitals. Sports Extra with Temisa Nukomi kicks off now, and TDS rolls on in just a few clicks. So stay with us.
This is Live More Life, brought to you by Lagoon Hospitals.